So, Dr. Handelsman, what initiatives are being rolled out right now to help control the diabetes and the obesity epidemic?
Well, you know, one to say is what the First Lady of this country is doing, and is holding on an initiative to curtail obesity in kids, which I think is a very important initiative that she does. I think the three associations, the American Association of Clinical Endocrinologists, the Endocrine Society, and the ADA is will also do well type of initiative. But everybody is talking about it. There's some drugs for obesity out there. There's surgery for obesity out there. But the very big, large obesity across the country, we just heard, you know, talking about it. Should we start giving some kind of money to patients to manage the weight? Whatever name you want to call that, that's part of the initiative. But other than that, it's pure health care.
It's tough. It's tough. You know, one of my professors once said the reason he knew that it was tough to control weight is that nobody ever lost money on a diet book. Everybody wants the quick fix. Everybody wants the magic diet. And there is no magic, is there?
Well, you know, I worked with one of the guys who has been the most experts in obesity in the world. And when he retired, he sent a letter to Dr. Atkins, who at the time was still alive and working. He said, "Dear Dr. Atkins, since you and I started working, this country went from 2% obesity to 35% obesity. How about you retire as well?" And then we know it's very hard. There's a lot of initiative. There's a lot of money that's involved in that. There are a lot of goals to understand. I think that the direction we took now to try and individualize management, to try to focus on drugs that will help you not just control glucose but also lose weight, is maybe paying off.
Well, what's the role of the National Diabetes Prevention Program and similar programs nationwide? What do you think, Dr. Schaecher?
Well, I think they provide a guidance, a backbone to the efforts that need to occur at the local level. Healthcare, like politics, is local. And you can have grandiose programs, but unless, again, that patient is touched at an individual level, something that matters to them, they don't engage into it. So the NDPP helps provide guidance for clinicians, helps provide guidance for health plans to set up those programs that help get the patients involved. It gives them the rules of the road, so to speak.
Well, what are the current gaps out there? If you had to say that there are identifiable needs, gaps in what we're doing for both patients and providers, how do new programs and initiatives, both at the local and the national level, how do they bridge these gaps, or even do they bridge these gaps?
Well, I'll give you one example that maybe also goes together with the NDPP. So the people that designed the lifestyle part of the National Diabetes Prevention Program actually designed a part that would go online. So whatever it is, whoever can go online, it may work. It's not very sustainable, but what they did better was they actually partnered with a YMCA. And now they are going into the communities, and now they try to offer a less expensive solution that would be within the community, that would be relatively easily accessible. So this is kind of ways that people try to go around. In other ways, food. You know, healthy food is expensive. So now there are resources out there to show communities where can you go and you can get produce cheaper, where can you go and get less expensive meat cheaper.
And that's actually been some of the impetus behind urban gardens.
Yes.
You know, cities actually using vacant plots of land to allow urban neighborhoods or even suburban neighborhoods to use that land to grow their own vegetables. And because two things happen there. One, those are your vegetables. You take ownership of that, and by golly, they're going to do well. You're going to eat them. You'll be healthier. But also, guess what? You have to tend that garden. You actually have to get out and do some things.
Oh, you sneak. You're going to get them exercising.
You get them exercising, and they get involved with their life, and they're not just passively sitting there or driving up to the drive-up window at McDonald's to get their their vegetable.
And to be fair, it's not just McDonald's. McDonald's takes a big hit,
right.
but there's
It's all
lots
fast
of fast
food.
food.
Oh, it's all fast food. It's all high caloric, high glycemic index food. But you asked, what are some of the current gaps? And earlier in our discussion, I talked about, I think one of the key gaps that exists is the adequate resources being made available to patients and clinicians to manage the whole patient. So not having those resources available to many providers and patients readily is important. And you see programs being developed locally, regionally, through health plans or through health systems that start to focus and target those.
All right, well, let's talk about pharmacotherapy.